Hello, and welcome to the Dr. Suzette Glasner podcast. If you haven't subscribed to my channel yet, please take a moment to do so now. If you have a comment or question that you don't feel comfortable putting into the chat for any reason, please feel free to email it to me at askdrglasner@gmail.com. Today, I'm going to talk about new research that highlights the challenges that women face in seeking treatment for alcohol use disorders. We know that the gender gap in alcohol use is narrowing, with women increasingly keeping up with men in terms of the quantities of alcohol that they consume. But at the same time, new research has shown that women are less likely to seek out care or treatment than men with alcohol use disorders. So today we're going to talk about a couple of things. First of all, why that might be. Second of all, why we should be concerned in particular about women and alcohol use and the unique effects that alcohol use can have on women, both physiologically and psychologically. And third, if you are a woman or if a woman in your life who you care about seems to have a problem related to their alcohol use, what you can do with this information and this newfound understanding of why it is that it might be more challenging for women to seek out and access care. So I'll start by saying that men are more than twice as likely to seek out care or treatment for an alcohol-related problem than women. Study after study have shown that women tend to experience more shame around their alcohol use, especially if they view it as problematic, than men. They seem to feel more concerned about being stigmatized if they talk openly about their drinking and admit to excessive alcohol use, and that's something you obviously have to do if you're going to benefit from treatment of any form. So shame is number one. Number two is the cost. You can survey men and women who have the same healthcare benefits, roughly, and ask them how affordable they think treatment might be for an alcohol use disorder, and women consistently express more concerns about treatment being more expensive than what they would be able to afford than men. They also report that they're really not sure how to access treatment. So somehow there is a gap between men and women in terms of understanding of how to access treatment, as well as concerns about affordability of treatment, even if all other things are equal and the cost of treatment would be equivalent for the men and women in the study. Women are just more worried about that. The third reason is that women, more often than men, don't recognize problematic alcohol use as a problem. So their perception of their need for treatment is different from men. And then finally, women who are caregivers in particular tend to have a lot of fears around the implications of accepting or seeking treatment for their ability to care for their children, and especially in terms of the legalities surrounding mandated reporting. A lot of fears around losing custody of their children if they are openly discussing and admitting to problematic alcohol use. And this is actually worsened or exacerbated by the ways in which healthcare professionals often provide little or no information to women about what will happen if they talk about their alcohol use. Mandated reporting laws tend to be pretty specific, and that kind of education around what would be safe for them to talk about without compromising their potential to legally care for their children is something that women really need to have deeper conversations about in order to feel comfortable, but often those conversations don't really happen, or they happen in such a limited way that they're not convinced that it's safe for them to talk about these problems. So those are just some of the reasons. There are others, but those are the ones I thought it'd be important to highlight because we actually have the potential to overcome a lot of them and help women enter treatment more readily, mitigate some of the cost concerns, provide more information around how to access treatment, break through some of the stigma that they are concerned about just in our way of talking to them, and also help provide the support that they need in order to overcome some of those feelings of shame that may otherwise have kept them from treatment or made them afraid to seek out treatment or talk to somebody close to them about the extent of their problems. So why should we be worried about drinking among women in particular? And why devote an entire episode to just talking about women who drink? Women are uniquely vulnerable to many of the effects, both physiologically and psychologically, of alcohol use in an especially concerning way, given this trend of lower likelihood for them to seek out treatment or help for their alcohol use. So first of all, we can talk about the mental health side of things. Men and women tend to report that their motives for drinking are very different. Whereas men like to drink for the positive and pleasurable and rewarding effects of alcohol, women more commonly will drink to alleviate some of the negative emotions that they are dealing with, whether that's depression or anxiety or stress. Women are more likely to report drinking in this sort of self-medicating style. The bad news about that is that while alcohol use acutely or in the short term can make a person feel less stressed and more relaxed and less depressed and less anxious, in the longer term, when a person is drinking chronically and heavily, all of those symptoms tend to become worsened. So that also compounds the sort of mental health impact of something they were already struggling with by self-medicating it with alcohol and finding it worsening. And then they find themselves with more than one problem. There's the depression or the anxiety or whatever the negative kind of emotion that they're dealing with, and there's now this alcohol use disorder. And women are a little bit more likely to seek care for the mental health side of things and not as likely to seek care for alcohol use. And depending on the setting where they go to in order to address the mental health condition, they may or may not pick up on the fact that there's also an alcohol use issue because women don't as readily talk about their drinking behavior as problematic in the way that they will talk about some of their mental health symptoms. So that's another way in which the drinking problem could get missed in a medical setting. Apart from the mental health impacts of alcohol use on women, they're also more susceptible to a number of toxic effects of alcohol use on their bodies. So they're more susceptible to liver disease than men. They also begin experiencing more severe alcohol-related health problems sooner in the course of their chronic alcohol use than men. And this is known as the telescoping effect. And it's something that scientists have written about fairly extensively. And there is good evidence for it, that there's a shorter course of problematic drinking for women before their health becomes impacted. So in essence, they have less time to correct it in order to avoid impacts on their health and well-being than men do. Yet what we're seeing from the study is that at the same time, they're less likely to seek out that kind of help. So we really need to do something to move the needle on that. They're also at greater risk of mortality from cardiovascular illness. And we have learned from studies that have emerged and become publicized in the media over the past year about the heightened risk of cancers in relation to alcohol use in the general population. So that's not limited to women, but in particular, breast cancer is a heightened risk for women who drink. We know that susceptibility to it increases by 5% for every additional drink that they consume on a regular basis for women who are premenopausal, and 9% for each additional drink among those who are postmenopausal. So this is a pretty serious potential impact on longevity, health, and well-being for women. Another interesting phenomenon that we have noticed is that while the rates of alcohol use disorder have been slightly decreasing among employed men, they are not decreasing among employed women. Some of the reasons that this has been hypothesized to be is that women are experiencing some gains in terms of both their work and level of education, and this is placing them in positions with more significant leadership, authority, and responsibility. So one of the hypotheses around this difference is that there could be factors like job stress and workplace cultures of drinking that make it even more difficult for women to resist drinking when they're in the workforce and when they're in some of these types of high demand, high powered position. And I'm talking about high powered positions because we're also seeing research indicating that women in higher prestige careers show increasing trends in binge drinking compared to men in higher prestige careers. So there's something about the pressures that women are facing in these positions that make them more vulnerable to seek out some type of self-medication, which again is consistent with the broader literature on the reasons that women use alcohol to often deal with stress, anxiety, and other kind of negative emotions. So this could be heightened among women who are in the workforce and dealing with multiple competing demands at home and at work. One thing we know is that women take a long time from the time that they actually recognize that they have a problem related to their alcohol use to the time that they actually seek out treatment. So studies show that on average, it's 10 years from the time that they recognize they have a problem to the time that they seek out treatment. Now, given the telescoping effect that we just talked about, the fact that women will experience the toxic effects of alcohol on their health and on their physical well-being much faster in the course of their problematic alcohol use than men, we can't really afford a decade-long gap from the time that they recognize they have a problem to the time that they do something about it, because there can be a lot of impacts on both their physical and mental health during that time frame. So your goal as a woman or as somebody who cares about a woman who is showing signs of problematic alcohol use is to try and help move that process along and shorten that time frame by as many days, months, and years as possible. And I'm just going to make 3 suggestions around how you can think about this. The first one is you should know that social and family support plays a really crucial role in women's entry into treatment. Part of the reason that women experience so much shame about their alcohol use and avoid talking about it is because they tend to be criticized very harshly for their alcohol use behavior. If you're a woman who is potentially in need of treatment, you really want to lean on the most supportive person in your life and your network, whether that's a friend, whether that's a trusted colleague at work, whether that's a close member of your family, whether that's a spiritual advisor or a therapist, whoever you're close to, who you feel very supported by, that's the person to confide in to hopefully handhold you as much as you need to in order to get to the place where you can receive treatment. Or if you care deeply about somebody who is struggling with their alcohol use, don't stay silent. Talk to them. Let them know that you care, that you are concerned, that you're there to help them. Anything that you can say or do to present yourself to that person as a listener and not a judger. That's super important because women are so vulnerable to feeling shameful, and that tends to shut them down. So anything you can do to show them that you're on their side, you're not judging them, you really are just coming from a place of caring, love, and respect, and want to help them get the help that they need, that can make all the difference in their entry to an engagement into treatment. We also know that among women, partner and child support or disapproval can be very influential among women in terms of their treatment-seeking behavior. So women are more likely than men to seek help when they're facing disapproval from their partner. So you can be loving and caring, but you can also at the same time voice that you're really concerned about the behavior that you're seeing and that it's not okay. Some people might respond better to somebody who's quietly supportive and waiting for them to develop an insight or an aha moment where they want to do something about their alcohol use. But when we're talking about women in particular, they tend to respond better to someone who's not shaming them, who's not judging them, but who's also expressing concern, and which is a form of disapproval of a behavior without acting judgy. That's not the easiest thing to do, but you can say, I love you, I'm concerned about you, but this is not okay. And I can't let you go on like this. I need to help you. I need to help you find some treatments. We also know that the drinking habits of close friends and partners can strongly influence treatment seeking. So I would encourage you to consider going sober with your loved one, even for a temporary period of time, for a period of 30 days. We're at a really interesting turning point in terms of the attitudes, beliefs, and behaviors of young adults towards alcohol use. There is this whole sober curious movement that's going on where it's not so uncool to be sober now like it used to. Being sober for health reasons is much more socially acceptable than it used to be, especially in light of all the information that's coming out over the past year in particular around the health risks associated with alcohol use. So I'd say being sober or doing a 30-day challenge or a dry January or sober October is in right now, and model modeling that and pairing up with somebody who you love or care about, who you think may be up for trying 30 days sober, even if they're not ready to go into formal treatment, is something that could really be helpful for them, because having that partner or really close friend who's always drinking around them is making it much harder for them to resist that alcohol, which is just human nature. You might want to check out my podcast episode on the 30-day alcohol challenge. It has some tips and pointers about how you can go about approaching that challenge. And then finally, I would say try leaning into online or digital treatment options. We know that telemedicine and app-based therapies overcome a lot of these barriers around shame and concerns about privacy, concerns about stigma, because you can do it from your smartphone, from your own home at a time that's convenient. You can do a lot of these therapies over chat or digitally, so no one's going to overhear what you're saying. And that really overcomes many of the concerns that women have about coming forward with their alcohol use issues. The other aspect of it to be aware of is that studies show that women are particularly responsive to technology-enabled forms of treatment. There have been studies on this that show that they respond really well in terms of having success and positive outcomes. And we also know in general that women tend to be more likely to seek out health information digitally than men. So there's something about women and online care that we're discovering over time seems to be a really good fit. So that's just a great thing to lean into in order to encourage a woman in your life, or for you yourself to seek out some treatment options that may be impactful, may meet many of those unique needs that women have when they're juggling multiple responsibilities, and also can be a less expensive alternative to traditional forms of in-person care. And I'll add, though a lot of people think traditionally that when you have an alcohol use problem, you may have to go to inpatient rehab or detox or something like that. There is a place for that and a time for that, and some people obviously need that level of intensive treatment, but most people can be treated effectively for an alcohol use disorder in an outpatient treatment setting, meaning that you don't have to be hospitalized. You can do this on a weekly, bi-weekly basis, really depending on your severity, your treatment goals, and your personal history of alcohol and substance use and mental health. So I hope you learned something valuable today. Help a woman in your life to find treatment by making it safe for them to talk with you about their struggles. Thank you for being here, and I will see you next time.